Peripheral vascular disease is a very common problem among our aging population. More recently, we've changed the name to peripheral arterial disease. The arteries are the plumbing that carry the blood to our lower extremities. The clogging of those arteries is called peripheral arterial disease. Peripheral arterial disease is the clogging of the arteries which carries the blood supply to our extremities. The people who are at most risk for peripheral arterial disease are diabetics, hypertensive, and particularly smokers. It markedly increases as the age increases. The symptoms of peripheral arterial disease usually relate to an inability to walk. It starts out first that you feel like you're slowing down. You're getting a little aching in your calves or maybe in your hips. It's often attributed to age, but it's really from a clogging of the arterial circulation. The complications of advanced peripheral arterial disease can lead to limb loss. What happens is that you may have a non-healing ulcer or some lesion. It gets infected. It doesn't heal. Unfortunately, this is sometimes the first marker for patients who have peripheral arterial disease. If it progresses and if it's not corrected, it can lead to limb loss. Unfortunately, limb loss is associated with a very high rate of mortality. The best treatment of peripheral arterial disease is prevention. Regular visits to your physician, checking for diabetes, making sure your blood pressure is under control, and absolutely don't smoke. Once there is a suspicion of a problem, it's really relatively easy to diagnose with just simple measurement of blood pressure in the legs and comparing it to the blood pressure in the arms.